And then a month into her having her little girl, she's like, I think I want to go to part-time now. And I said, that's okay. Your priorities sometimes shift when you become a mom, and you get to decide what you want to do, whether you're an associate in a DSO or even if you're an owner. It is perfectly okay if your priorities change once you have a family.
Welcome to Austin, Texas, and welcome to the Phil Klein Dental Podcast. Today's conversation is one that so many women in dentistry quietly struggle with, but rarely talk about openly. As with many professions, becoming a parent can completely change the way you view your career, your priorities, your identity, and even your definition of success. This especially holds true for dentistry. The pressure of balancing motherhood with the demands of clinical practice can push stress and burnout to a whole new level. So today we're having a candid conversation about what that balancing act really looks like and how women in dentistry are navigating motherhood while building and maintaining a career they enjoy every single day. Our guest is Dr. Christina Blacher, a general dentist based in Frisco, Texas, and the founder of Christina Blacher Consulting. She is an Align Global faculty member and international keynote speaker for Invisalign. Before we get started, I'd like to thank all of you for tuning in. If you're enjoying the show, please follow us on Apple Podcasts and Spotify, and even better, leave a review. By doing so, you're not only showing support for what we do here, but your reviews are instrumental in getting more dental professionals to listen and benefit from our content. We really do appreciate it. Dr. Blacher, welcome to the show.
Thanks, Phil. Happy to be here.
So this is something new for our show. We haven't talked too much about this topic, so I'm glad you're here to give us your perspective. So when you first became a mother, how many days a week were you working as a dentist? And did you worry about how you were going to balance the demands of dentistry with the demands of parenting?
Yeah, so let me give you a little background. I've been a general dentist for 11 years now, and I had my own private practice full-time, 4 days a week, and was just, doing my normal general dentistry thing. And I actually became really successful with Invisalign before I had kids. And so it led me to start teaching for Align and speaking. And so I knew I didn't want to be clinical full-time forever, but I started teaching and figured out that teaching is my passion. So I started to cut down my clinical days. And then in 2023, I had my son, and I had him at 35 weeks. And so he came really, really far in advance. I actually had to cancel events that I had that week, and he was in the NICU for a couple of weeks. But I will tell you, I was really worried at first. Having kids was going to kind of interrupt my career, I guess I should say. And this is something that not many women talk about, because I was worried that people aren't going to ask me to do events anymore. I'm not going to be as busy because I'm going to have to focus on my kids. But I'll be honest with you, Phil, I became more successful after I had kids.
Yeah, now how did that happen? I mean, because I know what it was like to raise two kids. Of course, my wife did most of the work.
Yeah.
I'll give her credit for that for sure. But it was a full-time job, and dentistry ain't easy. And that's
No.
You were Invisalign person. You were just doing a ton of those cases. You weren't.
Yeah, I was doing all general dentistry. And then when I found my passion in Invisalign, I wanted to kind of do Invisalign only. So it all kind of happened at the same time.
When you had your son, right? What
Yes,
changed?
my son was my first child, and then I had my daughter a year ago next week.
So how did you keep up the dentistry in the early part?
It was tough, for sure. Here's something that not many people know outside of dentistry is you don't really get a maternity leave with dentistry. Like if you're not in the practice, you're not making money. And so we're all under stress to okay, keep the office running, keep the books running, making sure your team's getting paid. And not many dentists take a full maternity leave, which is hard. I kept working remotely as much as I possibly could, doing teaching and webinars and things like that. But I will tell you, when I had my son, it actually led me to start my consulting business, because I traveled every week leading up to the birth of my son, and I'm always on the road doing events. And so I actually realized that I can't be everywhere all at once. And so I actually created online content through an LMS platform of my own. It's called Dr. Christina Blacher Consulting, and I basically put all of my content online. And the funny part was I did that during my maternity leave with my son. And so what most people don't know is he was laying there next to me as I'm creating all this content.
Okay, so you had an exceptional opportunity to, work from home. But when we're talking about a woman who becomes a mother, the mother is the life support system of that child for a good bit of months. they obviously have to take some maternity time, right? I mean, you can't go
Yeah.
to work and work a rigorous general dentistry day when you have a newborn. So what kind of advice would you give female dentists who are thinking about starting a family but are worried about how it could affect their career or
Mhm.
personal life?
Yeah, I will tell you, don't stress about it because it will all work itself out, whatever it may look like. Maybe it's not working full time anymore. Maybe it still is. I still love what I do. And so I just became more intentional after I had kids. And so like I said, I actually became more successful. And I know many female mother dentists that can say the exact same thing is they actually became more successful after they had kids because you just do things more intentionally because you
Right, but
have
you had to
less
change
time.
direction from clinical
Yeah,
dentistry.
I changed
Right.
directions because I found my passion.
Not everybody could start a consulting firm and
Hmm.
and do the things you're doing, traveling around and speaking. So for the regular, I wouldn't say
Hmm.
regular, and I don't mean that in any way where they're not exceptional or in their own way,
Hmm.
but for the female dentist who wants to remain a clinical dentist,
For sure.
they'll need to take some time on their own, right?
Hmm.
For a
Yep.
period of months, and then they have to balance clinical dentistry with raising their child. So if you were in front of a group of women similar to what I just described, what advice would you give them?
Yeah, I would say rely on your support system. We are always so guilty of things. I still get guilty as I'm sitting on an airplane and my daycare is calling because my kid has a fever and I can't be there to pick them up. And so, like, we're always going to be guilty about something, just carrying that, like, whether it's you can't be there to be there full time or you have a practice to support. And it's okay to rely on other people. I think they say that you need a village, but you truly do need people in your life that you can support, whether that's family members, babysitters, nannies. Don't ever feel ashamed for getting the extra help because we're not meant to do it all. We're not. And so I am a big believer in getting the support system that you need.
We often talk about how emotionally and physically demanding dentistry can be. Now,
Mhm.
you balanced it, right? You added motherhood into the equation. You have your own business, you travel and you lecture. What do you think some of the important things we should keep in mind as female dentists when motherhood hits us and we realize, okay, we have a big responsibility at home, but we want to keep our practice going? What
Mhm.
kind of attitude or just outlook and mental awareness, mindset, I should say? What kind of mindset are we talking about to keep everything sane where it doesn't get out of control?
I'm a big believer in like, know that you're not alone. Every mother dentist is dealing with the same things. And it's like going to work is not a break for us. Like we go to work, but then we're still worrying about like, what's for dinner? What do we have to order on Amazon? Who's got to be picked up for what activity? Like, what do we have to plan for school? And it's so funny because like we juggle it. There is no such thing as balance, in my opinion, Phil. It's like we're usually either focused on one thing or we're focused on the other. The one thing I will tell you that motherhood really taught me was one, how to set boundaries, how to say no. I actually got more confident in like my patient experiences because I learned that like if you don't take care of yourself first, you're not going to be able to give into others. And so like I actually started therapy after I had my son because we went through a pretty traumatic event, and I think every mom should have a therapist or somebody to talk to because you can't fill from an empty cup. You have to take care of yourself first in order to pour into your patients, to your staff, your team members, to your colleagues, anybody that's around you. And so the biggest thing is you're not alone. There's no such thing as balance. And you are going to carry that mental load. Sometimes you give more to your career than you do to your kids. Sometimes you give more to your kids and you feel guilty for not giving enough to your career. And it's something that we just all deal with. And it's totally normal.
So, with your experience, and you've mentored quite a number of women that are in the situation of starting a family and also wanting to maintain their career, and they inform the dentist owner of the practice what their plans are. What does that discussion typically look like?
It depends. So I'll give my sister as an example. My sister just had a kid a couple months ago, and she's a dentist, and she's an associate in a practice. And her whole pregnancy was telling her practice, I'm going to be back. I'm going to be back in 2 months. I'm going to be back full time. Don't give up my spot. And she like obviously was worried about that. And I told her, I said, just wait because your priorities might change when you have a baby. And she's like, they're not going to change. I know what I want. I want to be full time. And then a month into her having her little girl, she's like, I think I want to go to part time now. And I said, that's okay. Your priorities sometimes shift when you become a mom, and you get to decide what you want to do, whether you're an associate in a DSO or even if you're an owner. It is perfectly okay if your priorities change once you have a family.
So, what do you recommend the lead time to be as far as notifying your employer about your plans to have a family?
Yeah, I would say as far in advance as you possibly can give. But keep in mind, a lot of our team members, I had assistants that were scared to tell me they were pregnant because they thought they were going to, be replaced or be not as valuable. But obviously, going through having children and becoming a mom on my own, I'm actually way more empathetic now, especially to team members and other doctors, especially with planning, because we know that as much as we want to plan, sometimes things happen. And so we want to try to plan for it as much in advance as we possibly can, but then also have the backup plans there too.
I want to ask you about getting extra help for the female dentist in this case. Now, I'm a firm believer that the more that's on your plate, the more you get done, but up to a point.
Yep.
And when it comes to the responsibility of having a child and also working in a dental practice, to do both, there's no way that's going to be possible without having extra help. So talk to us about that, how important it is to get extra help, what kind of help, and I guess it varies from family to family, but give us an idea of what that's about.
Well, I will say my husband's an endodontist, so he works full time. And so I would say outsource as many things as possible. And it could be outsourcing somebody cleaning your house, somebody, doing groceries, like online ordering. It could be somebody watching kids, whatever it may be, outsource as much as you possibly can.
What do you outsource?
I outsource almost as many things as I can so I can give my children the love and attention. So I have a cleaner, I have lawn service, I have pool service, I have somebody who comes and meal preps for me once a week, and I don't have to buy the groceries, and it's so nice.
Oh, so they shop too.
They do, yes. I know I have a friend who has a nanny come at 6 a.m. every morning just because the mornings are chaos. And so it's like she gets to actually wake up, have her coffee, enjoy her time with her kids, and not have to be running around, packing lunches and doing all that kind of stuff. And so whatever it may look like, I have help every weekend. And it's funny because this is something people probably judge me for. My neighbors probably see I have a car at my house every weekend. I have full-time help on the weekends. However, I am with my kids that entire time, but I have somebody helping change diapers, handle meltdowns, and I get to just sit and play and be with my kids. And so I just like having that extra support.
Now, I mean, that, you need to have the resources for that. However, if it's a trade-off between working more as a dentist and having that quality time with your kid or your kids because you have the extra help like you described, then you really have to say, yeah, I'm perfectly fine with spending the money on this because I'm going to be allowing myself to work more days in the dental practice. So again, this is a priority-driven strategy that the female dentist has to decide with their husband, I assume, and say, how do we want to go about this? But, nothing's easy. I mean, a marriage is difficult at times. More than at times. Sometimes it's more difficult than not. And anybody that says that it's just a free sailing, dream is exaggerating. Let's put it that way. It's all worth it though, as long as you keep in mind that you have to work at things. And I think you have to work at this too, because you're like running a little company at home. Besides your consulting company, you're actually running a family, and that requires a lot of good decisions along the way.
Yeah, I actually saw something on Instagram the other week, and it was talking about identity whiplash. It's like we go from being high functioning, career minded women, owners of dental practices, running the show, being a leader, to like identity whiplash, coming home and arguing with a toddler over what color cup he wants to drink out of. And it's like, we have to learn to like shut it off. I will tell you though, becoming a mom has taught me to like reset my nervous system really quickly, which helps in dentistry, because a lot of us will walk out of an operatory because of whatever interaction we have with the patient. You have to walk into the next operatory like nothing happened. And it's funny because I've learned how to do that more since having kids, because I've got to learn to deal with meltdowns and I've got to learn to deal with toddlers right now. And I learned to like kind of reset my nervous system quickly. So
that is very important. Now, how much time do you spend on yourself, whether it's a sport or recreation, whether it's yoga? What do you do for yourself where you're not around your kids, you're not around your work? Because we all need to have that reset time. And sometimes there's this, and sometimes we sacrifice that time because we need that time for something else, and then it never happens. And that's where we run into trouble. What are your thoughts on that?
Yeah, always, always take time for yourself. And trust me, I feel guilty doing it sometimes. I like go to Pilates and I've got 100 clean checks waiting for me that people are waiting for me to do. And I'm like, you know what? But I need this hour for myself. Like I said, I go to therapy and I love it. I love just having somebody to talk to about like what's going through my brain and like somebody who's non-judgmental and not my spouse. And so
How
I would
often is
say
that therapy?
once a month
For
for an
what? An
hour.
hour?
Yeah, yeah. And it's just really nice to sit and talk to somebody. And I'll be like, my husband's driving me crazy. This is what he said today. And like, she's just is like a sounding board for me. Or I'll say, like, my
Husband's.
toddler like has an issue with going into the pantry. He wants snacks at every hour of the day. And so she'll give me like parenting advice and that kind of stuff. But it's
Yeah,
just
listen,
nice.
you married an endodontist.
Oh,
I'm an endodontist. So if my wife,
no way. I didn't know that.
yes, I am an endodontist. Yes, I'm not
Oh,
practicing, but yeah, that's our listeners know it because I bring it up every once in a while.
yes.
And I enjoyed being an endodontist. It was a great profession.
Hmm.
We, I didn't get full use of all the extravagant visual aids that we have today, like the microscope, but I did get
Hmm.
some mechanical instrumentation stuff. So I had some, and of course I didn't have CBCT. That would have been
Hmm.
really nice. I go
Yep.
to some endodontic offices and I look at their CBCT films and I go, oh my gosh, this
Oh,
is
yes. You would
so,
love his office.
yeah, yeah, it's so high tech. It's just, I mean, it's such an advantage
Hmm.
compared to what we
Yes.
have had in 2D. We used to struggle with all sorts of things because we just didn't have the visual
Mhm.
capacity with 2D. But we're getting into the technical side of it, but the marriage side of it, yeah, for all those women who are married to an endodontist, uh,
We should start a club.
yeah, Christina is right on target. Yeah. My husband's
Yeah, and
driving
ended
me
on it.
crazy. Yeah.
Here's Phil, you'll probably relate to this because my husband will come home and like my husband and I are great, but my husband will come home and he'll be like, I'm so tired. I worked so hard today. And sometimes we get in arguments of like who worked harder, but it's like he doesn't have the mental capacity because it's such a laser focused, like micro surgery type of career that like then he comes home and he's like, you just did clean checks all day. And I'm like, no, I also worked hard and I'm dealing with the kids and
Yeah. I
everything.
mean, it's understandable for uh, a dentist or anybody to come home to their spouse, and I hate to use the word complain, but that's
Yeah,
what they're
but
doing essentially. But they love you and they feel like they
mhm.
could, really trust the
Well,
conversation
yeah,
with
you're their
you.
safe space.
Right. It says, but on the other hand, they have to realize though that you had a tough day too, and you can't just be a sounding board for complaints. Right. You
Right.
can't be absorbing this stuff all day because it affects your
Oh, for sure.
happiness as well. Because no one wants to hear about someone else's issues all day long, and then after they tell you everything, they feel better, but you just sat through 20 minutes of it. So
Hmm.
yeah,
Yep.
we got to be
Yep.
careful
And,
there.
and
But
that's just learning. I'm very self-aware. So like I know when I'm feeling a certain way or when he's feeling a certain way, we have good communication techniques. But
that's
yeah,
really
it's
important. So, as we get to the bottom half of this program, I want to ask you about your experience working with dental companies and your contribution to the profession from the industry side. I think there are a lot of women out there who are practicing dentistry who may have a new child that wants to expand their horizon and pick up a microphone and share their knowledge and expertise with their colleagues. Like you said, the intellect talking to a 6 month old versus talking to another dentist is quite different.
yep.
But one of the things you need to do to become a speaker and a mentor is to kind of partner with the right dental companies because they're the ones that have the intellectual property behind the products. And, they pay you to do this, but you're one that has a great deal of integrity and only speaks on products that you feel work for you, that you've tried in your office, that really service your patients in a positive way. So you have to maintain that integrity. But tell us about the opportunities and the benefit of working with good companies, good dental companies, to start off or kick off a career in speaking, which is, like I mentioned, a great outlet and another way of expanding your career, especially as a woman dentist.
Yeah. So, like you said, I would never work with a company if I didn't believe in what they were doing. And I am an organic user always. So, like an example I'll give you is obviously I work heavily with Align. That's like my full-time passion. But I'm a key opinion leader for Ivoclar. And I've been an Ivoclar organic user since I was in dental school, believe it or not. And so I love their product so much. And so when the opportunity came to partner with them and be a KOL, I jumped at it. Number one, because they're an amazing company. They have great people and they really support me as a mom and a female in dentistry specifically.
How is that?
And
Give us an example of how they support you.
yeah, I mean, I've been up to Buffalo. I've done some recordings for them, made some content for them, but they've always been super supportive of like, work-life balance, your family comes first, always like, going around my schedule and being supportive of whatever decisions I want to do and what I want to make. And so I just wanted to give them a little shout out because they've always been that for me.
What
And
have you found to be very successful restoratively with Ivoclar?
I use a lot of their like ortho workflow items. I will say the Viva pen. So Adhese Universal is my all-time favorite from them because I use it with attachments with Invisalign, Optrogate, can't live without that.
And that's for isolation, the Optrogate.
Isolation. Yep, they're composites. I use both their flowable and packable Tetric, their Tetric Aligner and Tetric EvoFlow.
So more on the ortho side.
More on the ortho side, but obviously they have an amazing repertoire of products for restorative.
Yeah.
So
do you do clear aligner therapy exclusively now?
now I do. Yeah. So I'm a normal general dentist. And once I fell in love with Invisalign, I started teaching Invisalign and I got the opportunity to cut down my practice days and go to Invisalign exclusively. And I will say, after becoming a mom, I learned to pick what makes me happy. And honestly, for even those people who aren't a mother or a parent out there, just if you want to be happy in dentistry, do the things that make you happy. If there's something that really doesn't make you happy, for me, it's root canals. I've never done a root canal in my career.
Your last root canal was in dental school?
Yeah, my last root canal was probably my boards.
Wow.
And
we didn't have a root canal on our boards.
we had like the typodonts.
Oh wow,
but
we did
then-
not have that. Yeah, that's
yeah,
interesting.
But no, that's probably the last root canal
Yeah.
I did. And you want to know what's really funny, Phil? When I was an associate and I was interviewing for associate positions when I was a young dentist, I was upfront and honest to practice owners. There was one here in Dallas, and I said, I just want to let you know, I don't do root canals. I'm actually married to an endodontist. I just don't feel comfortable with my abilities, and he does it better than me. And they did not give me the job because of that. And at first I was upset because I was like, oh, I didn't get that job I really wanted. But then I was like, you know what? You have to be confident in what you want to do and what you don't want to do. And don't sacrifice your own happiness just to, do something that you're not willing to do. So
Yeah, so it worked out better for you. But the
Sure did.
clear aligner therapy, the big thing that I'm hearing, and I haven't done any because I'm at Viva Learning and I'm doing podcasting, but what I have heard from really smart orthodontists is that case selection is really critical for the GP. You could do quite a bit within clear aligner therapy within your realm of expertise as long as you control, what cases you pick. Do you find that to be true?
yes, 100%. I find there's so many doctors out there that just want to close the case that they don't even think about what they're closing. And then they get into a hard situation. And so it's always knowing your case selection, what you're comfortable with, what you're not comfortable with. And honestly, no dentist has ever regretted referring a case. People regret keeping cases all the time. And so you have to be confident in that as well. Sometimes I tell somebody, you know what? No, I don't think this is going to be a good case for me to do, and feeling perfectly fine with that.
So in addition to case selection, which is very important, we also have to be aware of collateral damage from the actual aligners. The patient's teeth are getting straighter, for instance, but things are happening on the side that may not be favorable. You've done hundreds of cases or thousands, I don't know how many. But
Thousands.
yeah, so how long did it take you to get to the point where you can actually discern things going on here that I have to intercept? Because you'd have to do that yourself. You can't really rely on the software algorithm to fix all the problems, right?
No, you definitely cannot. It's the algorithm is just giving you an algorithm, and you are a dentist and you know what's possible and what's not possible, or maybe you don't. And ask any of us who are up there speaking how we learned. It's because we all made mistakes and we all had to learn through that. And so it took me several years and several mistakes in my own cases, obviously taking advanced courses and education for me to truly feel confident in that. And now that's what I teach. I try to teach, especially the software, how to set up cases for predictability, so doctors don't have to make as many mistakes as I did.
Did you ever think that clear aligner therapy would take off the way it did? I mean, it continues to grow. Demographically, you see patients in their 70s in the ortho office sitting with a 12-year-old. And some of my friends that are orthodontists say they treat more people over 60 than they do kids anymore. I mean, it's just
Oh, yeah.
crazy stuff.
Yeah, well, everything I do for ortho is all functional and clinical, and the aesthetics are just a bonus. And so when you shift your mindset into seeing that, you diagnose more, you refer more, and you'll see most people need it.
And one of the huge benefits to the practice, of course, with clear aligner therapy is that after it's completed, the patient is like gung-ho to the next step. Let's get these teeth to look beautiful now that they're straight.
Yeah, 100%. Ortho restorative is so important, and it's something that I feel like we all missed back like even 5, 10 years ago. And so you only have to put on a beautiful veneer case for it to pop off for you to realize your bite's in the wrong spot. And so, yes, planning ortho restorative cases is what's
I know we got
the
off
big thing
topic.
right
We
now.
got off a little
It's
topic
fine.
off
We
our
went from
motherhood.
mom.
Yeah.
We
So
went from being a mom to Invisalign, but I could talk about any of
yeah.
this.
So
can
we have
keep
about
going.
4 minutes left. You certainly made some really good points in this conversation related to having a child and trying to keep a career going as a dentist for a female. Any closing thoughts before we wrap it up?
Yeah, it is perfectly okay for you to love being a mom, but for you also to love having a career. And you don't have to pick one over the other. It is perfectly fine for you to be nervous having kids and thinking they're going to intercept your career somehow. And that is okay too. We can do it all. It may look different from day to day, but you can find the support systems. You are able to do both and still live a happy and fulfilled life, whatever that may look like. I truly found my happiness and my passion when I had my kids, and it's led me to a very successful career. So whatever that decision looks like, just know that you will be successful, you will be happy, you'll be able to live your life.
Yeah, and make sure you have someone help you with the laundry, right?
Yeah.
Yeah, don't expect to do all the cleaning and the laundry yourself because that's not gonna work.
You can't.
Right.
You can't.
Okay, so at Queen of Invisalign is your Instagram.
That's my Instagram. Yep. And you can also find me on my website, drchristinablacher.com.
Right, and Dr. Blocker is spelled Blacher, and it's Christina. So it's drblocker.com, and Instagram is at Queen of Invisalign. Great stuff. I'm really glad you came out here to talk to us about something that we have never talked about. You know, that's what you would call a watershed situation, right? When you shift from being a regular person and then you become a mother, that's a totally different type of responsibility. You're not only taking care of yourself now and your husband, or if you have one, you've got a child there, and it's a completely different experience emotionally and physically demanding and so forth. So to balance everything is really important. So I think this conversation helped us do that, or will help us do that. Tell your husband I sympathize with any issues he has with his endodontic days that are difficult. I went through it too. So we're all sharing that together. All right. Thank you so much.